Hello, I am Dr. John Russo, Chief of Cardiac Surgery at the Davis Family Heart and Vascular Center at Baystate Health. Welcome. I'd like to take a few moments to tell you about our exceptional heart and vascular program. Every member of our healthcare team is specialized and devoted to providing excellent cardiac care that is individualized to your needs. The team strives for excellence in patient outcomes and is committed to providing an extraordinary experience for you and your family during your stay. Here with me are the cardiac surgeons who, along with a team of healthcare providers who will participate in your postoperative care. Doctors Daniel Engelman, Joseph Lack, and David Deaton. We hope you find this video valuable as you prepare for your stay at Baystate Medical Center.
I was outside in front of my garage, and it had snowed 2 inches. And when I picked up the shovel and lifted up a little bit of snow, I got this tightness here. I went and did the stress test. I failed it. The surgeon came up, Dr. Engelman, and he looked at everything, and he said, yes, you definitely need a quadruple bypass. I didn't even suspect that I had a heart condition.
The Heart and Vascular Center is a concentrated a type of place where patients are treated who have heart or vascular diseases exclusively.
When I came here at Baystate, when the caretakers came and started telling me first what their duties were and what they were going to do for me and how they were going to do it and what I could expect, I felt that I was in a military operation, that they were actually the crew I needed to do what was needed, and they were amazing.
You must meet the cardiac surgery team. You must sit down, hopefully with your family present, with the cardiac surgeon and discuss, first of all, why you need the surgery, what the expected benefits of the surgery would be, what the risks are of undergoing this procedure, and then a review of this video, reading the cardiac surgery booklet, as well as having further discussions with the cardiac surgical team that will be taking care of you.
After you see the cardiac surgeons in the office and it's deemed that you need surgery, you will be scheduled for a pre-admission visit here with us in the care unit. It's during that visit that we will ask you to bring a medication list with you prior to surgery. You do not need to fast in order for this appointment. During your visit, it's going to take about an hour. We will review your medical and your surgical history with you, go over your medications, and give you your instructions for morning of surgery. You will receive this home safety checklist from the cardiac surge office. Please bring it with you back to your appointment. During your visit, you will have your pre-op blood work drawn. We will also ask you for a urine sample. You will have an EKG performed. At the end of your visit, the nurse will review what you need to do prior to coming in for your surgery. You'll get your medication instructions to come in that day for surgery. You will also, on your way out, need to stop at radiology to have a chest x-ray. Then you can stop at the pharmacy for your pre-op prescriptions. At the end of your visit, you will get a green folder that has all your information in it. Please bring this with you back for your morning of surgery. Morning of surgery, we will ask that you come in 2 hours prior to your surgery. When you arrive back at the care unit, you will be greeted by a receptionist and brought to your pre-op room. You will be asked to change into a hospital Johnny, and then you will meet your pre-op nurse. In the morning, you will also meet with the cardiac surgeon who will come and put his initials on your chest. You will meet with the anesthesiologist who will be performing your surgery. You will also be meeting the OR nurse that will be in the operating room with you. Morning of surgery, you will also have an IV placed in either one of your arms. You will need to be clipped and prepped from the waist down, which does include shaving your chest and/or legs. You will be signing consent forms for surgery and for anesthesia. It's normal to be nervous, and anesthesia will give you medicine prior to going in the operating room after your consents are signed.
Well, I remember several staff members coming in. I remember the anesthesiologist coming in explaining what they were going to do. Then when we got down into the operating room, it's like, picture a a colony of ants going all around the room, and each knew what they were supposed to do. I knew I was among pros.
So we'll see you and do a full history and physical exam and talk to you and address any concerns that you might have regarding the anesthesia. Once you are asleep, you don't have to worry about anything till you wake up.
Yep.
Our job is to be there with you as perioperative physicians throughout the entire procedure. And we're basically your medical doctors while the surgery is taking place.
We have 4 hybrid operating rooms, which have installed imaging technology that allows us to do combined operations where imaging guides the operation and allows us to do many things under minimally invasive processes. We also have 2 co-functional rooms that are for open heart, and those rooms also have imaging capabilities.
It requires a tremendous collaboration between various specialists, and some of these are anesthesiologists, some are vascular surgeons, cardiologists, and interventional radiologists. It's through this collaboration that we're really able to tailor a specific treatment for a specific patient. The most important aspect of this working together is that we learn from one another. And working together, we come up with new ideas and solutions to problems that have never, ever been thought possible. And it really is truly the golden age of our treating cardiovascular disease.
The nurse, it's almost like she knew that I was waking up right then. And she was right there and asking me how I was feeling and could I breathe all right.
Your nurse is going to be with you one-to-one for the first 6 to 8 hours after your surgery. The lights are going to be bright. There's going to be lots of beeping, different alarms, and you're going to hear many voices coming from around the room. That's the clinicians discussing your care. You're going to feel lots of tubes and wires coming from you to the monitors. The cardiac monitors are there to help us aid in your treatment. You'll feel in your mouth and your throat a tube that's going to be connected to a ventilator, and that's helping you breathe until you're awake enough that you can breathe on your own.
The thing that I remember the most was when I took my first deep breath and there was no tightness in my chest and I didn't have that pain anymore.
The design of the Heart and Vascular Center is such that the rooms are all private, and they allow the families to stay with the patient, even in the intensive care unit, and provide support.
I love the spaciousness of the room. I loved the fact that I had a beautiful view.
So when you come to M6, things are a little bit different than the ICU. We will check your vitals every 4 hours. You will have your sugar checked 4 times a day. When you're on our floor, we do try to get you ambulating right away, even if it's day 1, and even if you still have some tubes. We want you to walk at least 3 times a day in the hallway. Some more important things are doing your incentive spirometer. It's a tool to help you take big, slow breaths to help open up your lungs, help promote better oxygenation. So we'll give you a pillow or like a tight blanket to hold to help you splint when you cough, and that'll also help with pain. While you're with us, we will help you care for the incisions. We'll keep them clean.
A case manager will be assigned to you from day of admission until day of discharge, and will continue to evaluate and assess and coordinate your post-acute care needs through a collaborative team approach. If you're able to return home, we encourage that a family member or a friend will stay with you for at least 1 to 2 weeks to make sure that transition from hospital to home is a safe one.
I knew right from the beginning that the staff, the carekeepers, from the nurses to the physician to the anesthesiologist to even the cleaning lady who came in and made my room immaculate every day, in fact 2 or 3 times a day. When they were doing this, they were doing it because they wanted me to get better, and they wanted me to leave that hospital in a much better condition than I entered.
A visiting nurse will be coordinated with you prior to leaving the hospital and will usually call you one day after discharge to set up a time for an evaluation. They will provide skilled nursing services to you for approximately 1/2 hour per day for 1 to 2 weeks based on their assessment, and will be provided a copy of your discharge summary. So if you are feeling weak and deconditioned, the rehabilitation team may suggest a short-term rehab stay prior to returning home. A case manager will provide you with a list of facilities for review and will coordinate with you a short-term rehab stay prior to discharge. We encourage family or friends to tour facilities of choice.
Cardiac rehab is really going to start 24 hours to 36 hours after your surgery. We're going to meet with you in the hospital because it's that whole healing process and movement and getting better. So we're going to meet with you right in the beginning for that active range of motion, using your incentive spirometer, getting up, walking, helping your family understand how your recovery is going. It's not just the physical healing that we have to talk about, but any type of major surgery that sort of puts you back from where you think your lifestyle should be or your activity levels should be, sometimes gives you that feeling of maybe a little bit of hopelessness or a little bit of depression or even sometimes despair. One of the things I want you to keep in mind is that that's not unusual. You will have those feelings, but that's why we're here. So we'll be setting up a date and time for you 2 to 3 weeks after your surgical date for really coming into outpatient cardiac rehab for that continued recovery.